I'm Sherry Boschert reporting at ICAC 2012. I'm with Dr. Jessica Njoku talking about combination versus monotherapy for C. diff infection. Why did you do this study?
So this study was part of my fellowship project when I was at the Nebraska Medical Center, but the main aim of doing this study was, the rationale premise behind it was because we were seeing a number of our patients that were being put on combination therapy of vancomycin and metronidazole, seeing that we had antimicrobial stewardship program there. So most of the time we're advocating for rational use of anti-infective, and so a lot of times we made recommendations and they weren't really accepted, and there wasn't really any evidence out there supporting the use of combination therapy. So this was a retrospective chart review of every patient that received C. diff quick, which is an ELISA-based test, and we classified these patients based on the type of C. difficile infection they had, meaning mild, moderate, severe, and severe complicated. The recommendation for treatment is based on those different types of C. difficile infection. So mild, moderate, you would generally treat it with metronidazole, and as the patient gets severe, then the recommendation is to treat it with vancomycin. We adjusted for the differences in severity of illness of the patients in our model. What we found that there was really no difference whether the patients got monotherapy for their C. difficile infection severity or combination therapy for the same C. difficile infection. There wasn't really any difference, in the time to resolution of diarrhea. Having better length of stay or even mortality was not different.
Did this surprise you?
It did, because the contention would be that if you gave more drug, the patients would get better quicker and also have less mortality or length of stay, but we didn't find that. So it was very surprising. And we also did look at recurrence. We only included first recurrence, and our first recurrence was very low, about 5-6%. So meaning that if you got monotherapy, you weren't really at risk of recurrence versus if you got combination therapy.
What do you think are the clinical implications of all this?
Definitely the clinical implication is that this provides evidence now where we never had any evidence before on using combination therapy to treat C. difficile. It clearly indicates that maybe we shouldn't be putting patients on combination therapy. Monotherapy is sufficient, or if your patient is not responding to that monotherapy, maybe switch them to another agent. For example, if they're getting metronidazole and they're not responding to therapy, maybe consider switching to vancomycin and not adding on vancomycin to metronidazole therapy.